How long does therapy take? Does it ever end? Will I ever get results? As a therapy client who has seen multiple therapists throughout my life, I have some answers for you on these questions. Who better to ask how long therapy takes than somebody who does go to therapy? My name is Caylyn. I am not a therapist, and I thought it was really important to share this video because I think a lot of people worry that therapy is forever or it's going to be a huge expense for the rest of their lives. So I'm here to tackle all that. Make sure you subscribe to get more videos from a therapy client. How long therapy takes depends on three things: the type of therapy services that you're accessing, what you're going for, and how much work you put into it. So how long therapy takes could depend on the type of therapy service you're accessing. But what does that even mean? So this is anything from, how much your insurance covers, to whether or not you're seeing somebody who has a private practice, to if you're getting this through an EAP program, employee assistance program, for those who don't know. Often with EAP programs or something that's funded through employment, you get 5 to 7 sessions. The idea is you walk in there, you're probably paired with a social worker or something like that, and their job is in 5 to 7 sessions to figure out what your goals are and then give you all the tools that you need to deal with that thing, and then it's over. How long therapy takes could depend on your insurance plan. How much does it cover for the year? In that case, you might want to do, if it covers, let's say it covers 12 sessions, you might want to do 12 sessions once a week for 3 months, and that's everything. Or you could spread it out and do a session once every 4 weeks, once every 6 weeks, depending on what it is that you're working on. So I think it really depends. If you're going to see a therapist that has a private practice, infinite. As long as you have the money, you can see them as much, as little, for as long or as short as you like. The second thing that can determine how long therapy lasts is what you are going for. If your job is really starting to stress you out and you're really starting to have a hard time handling that, or home life has suddenly gotten a little bit difficult, you might be going to therapy just to learn some new life skills, coping skills, stress management skills, in which case therapy will end sooner rather than later for something like that. In that case, the therapist is giving us all of the tools that we need to learn and deal with the thing, and then have these skills that we can continue to use even after therapy is over. That's something obviously that you can continue if you like. You don't just have to stop therapy as soon as you have the skills, but it depends on what you're going for. Now, if you are going to therapy to deal with something more severe like trauma, emotional neglect, childhood abuse, that's going to take a lot more time. You can't necessarily just learn a set of skills and off you skip on your merry way. Often there is a lot of deeper work that needs to be done, and having the help of a professional will actually, believe it or not, expedite the process. Trying to deal with those things on your own is possible, but it's a lot more difficult not having someone who is really educated in these kinds of things, who's impartial and can help guide you through these things. As Brené Brown likes to say, sometimes the waters are swift and deep. That's her polite version. Her less polite version, more Brené Brown version, is sometimes there's deep shit, and that takes time and effort and work to deal with. And there's nothing wrong with that. At some point in our lives, every single one of us has some deep shit we gotta deal with. The third factor in determining how long therapy is going to last is going to be the work you put into it. If you prioritize this work, chances are you are going to see results sooner rather than later. Now, I don't believe that this is about working hard necessarily, although that is important, but it is really essential to work consistently at what it is you're going to therapy for. Often, a lot of us graduate from our therapist. If we're going to see somebody specific for a specific reason, chances are you will get to a point where you graduate and that therapist feels that you have accomplished your goals and you are able to move on from their services. Often this happens with programs where you go for something specific, but it feels really good to get to that point where you can graduate. Statistically, a lot of people feel that they get what they needed out of therapy in 12 to 16 once per week sessions. Now, the thing about this statistic is that it does say that this is highly individual. It depends on what you go to therapy for, what skills you're trying to learn, and what potentially might come up while you're in therapy. The short version is you need to put in the work to see results. If you're just putting in the work by going to a therapy session once a week and not practicing any of these things that you're learning or being mindful about them outside of therapy, you're probably going to be in therapy for much longer. If you haven't started your therapy journey yet, or you've only been on it for a short amount of time, here's a little insight. Most people that I've spoken to that have really put work into therapy have actually decided to continue with therapy even after their goals are completed or they feel they have, accomplished learning and acquiring those life skills that are going to help them out, because it's a really nice aspect to have out of your support system. Even to just go talk to someone once every 6 weeks and have a little check-in can be really reassuring. Thank you so much for watching this video. If you want to learn a little bit more about finding a therapist, check out my video on 5 red flags to watch out for. I'll link to it in the cards and it'll be after this video. Otherwise, please subscribe. It's going to help me continue to create client-focused videos like this. Please comment, like, share, subscribe, and I will see you next week. Cheers.